moving to House Bill 1455. This is now moving away from dispensaries members, and if you look at the descriptions, looks at the qualifying patient, primary caregiver relationship, the amount of marijuana, among other things. So we have comments from Department of Health.
We'll stand on our written testimony, bringing attention to what we believe the optimal patient-caregiver ratio is and what we believe the need for subset.
Thank you, Mr. Kim, and thank you for being with us on a Saturday. In opposition, Chief Harry Kubujiri. In support, Ms. Sugano. In support, Dana Sikone. In support, Raphael Kennedy, Drug Policy Forum. Mr. Sikone. And I will get your name correct, Sikone.
Just keep murdering it.
I am married to Italian, and I say Belatti, so Sikone sounds right.
Sikone. But you can say it any other way you want. It doesn't really matter. But anyways, this is on 1455, correct?
1455, yes.
All right. So aloha, Chair Belatti and Vice Chair Creagan at the moment, and all other members. Mahalo for the opportunity to testify today. Like I said, my name was Dana, and I was a designated caregiver on the task force, and I'm a current caregiver in the program. And I support HB1455 strongly, as we need to make a change in this flawed system of caregiver-patient ratio. Being a caregiver in the program for years and only be able to change the life of one person is not just sad, but a waste of time, electricity, money, and resources. Days ago, I visited with a family whose child benefits from using cannabis leaf smoothies. And hearing the stories and seeing firsthand how this child has to live with cannabis, without cannabis leaves, is devastating. Choking and gagging, barely able to hold his head up. And I can't help him because of the current laws. And I know I could supply him so he could have 3 smoothies a day. His family doesn't have time to grow cannabis. I have to think about daily this little angel and his parents are fighting for a better quality of life, and I can make a difference right now, today. Meanwhile, they all suffer. Also, being able to work together with other qualifying caregivers and patients would be so beneficial in the pursuit of the proper strain that alleviates certain ailments. Please support this bill. There are real people daily suffering for this plant. Let's get it to them. Mahalo.
Thank you, Dana.
Yep, thank you.
In support, Raphael Kennedy, Drug Policy Forum.
Representatives, thank you again. I just had a few quick points about this bill. I wanted to point out that currently in the state of Hawaii, there are 13,000 registered patients, but there are only about 1,600 registered caregivers. Increasing that ratio of patients, increasing that, the ratio of patients to caregivers, not the other way around, would be a reasonable step, especially in the short term while we're waiting for dispensaries to ramp up and get going. I think that we're generally in support of a more regulated system, such as the dispensary system proposed by HB1455. But the problem is that long lead time. And so if a bill like this can help patients that can't grow their own cannabis now, we would support that. I'd also say the bill includes provisions allowing for an increase in the plant count. And I just wanted to remind people or inform if they're not aware of the fact that that plant count does not make a distinction between mature and immature plants. So 7 plants seems like a lot if you're picturing 7 fully grown plants. It's a lot less if you're considering some seedlings or clones and some male plants that aren't useful. And also just to point out that recent changes in the Department of Health's administrative rules may allow for easier enforcement of caregivers. So new DOH regulations allow for or require patient or caregivers to tag plants with patient information. So in the past, law enforcement has opposed an increase of this caregiver to patient ratio on the grounds that it might make it harder to tell if caregivers are in compliance. But we think that those changes may may make that easier.
Thank you, Mr. Kennedy. Testimony in opposition, prosecuting attorney, City and County of Honolulu.
Good afternoon, Chair, members of the committee, Honolulu Deputy Prosecuting Attorney John Ricky Karamatsu. We're in opposition to House Bill 1455. The big concern we have is the increase in the plants. Basically, increasing it to 16 marijuana plants, whether immature, mature, and 8 ounces of usable marijuana at any given time is more than needed for a single patient. Also, if you take a look at a primary caregiver who has 5 qualifying patients, they would have 80 marijuana plants and 40 ounces or 2.5 pounds of usable marijuana. And if you can picture 80 marijuana plants, it's like building a forest. So, that's our concern. And also the transfer part, we have some concerns on that. Looking in mind with the other measure that's moving forward, it will not be necessary if we have certain secured facilities. Transfer between patients and growing would not be necessary. Thank you.
Thank you. Testimony in opposition, Jason Kawabata, Captain Jason Kawabata, City and County of Honolulu Police Department.
Good afternoon again, Chair Belatti, members of the committee. One thing about the limits, in my experience, we police department opposes this bill. My experience in narcotics vice is the limitations set in the law. Some people take it as a goal to be reached, or maybe something to surpass even. 1 ounce of marijuana is about a sandwich bag, as was stated earlier. 1 ounce of marijuana, standard joint is 0.5 gram. You can make approximately 56 joints out of an ounce of marijuana. If you're going to increase from 4 to 8 ounces, it'll be 448 joints, and not even counting the plants. This is just the processed marijuana. If you increase from 1 to 5 patients on top of that, that's 2,240 joints. And I'm convinced that if you allow this to happen, at least some of that is going to be diverted for illegal use. Thank you.
Thank you, Captain. Testimony in opposition, Walter Yoshimitsu, Hawaii Catholic Conference. Thank you. Testimony in opposition, Hawaii Family Advocates, James Duke Iona. Testimony in support, Kat Brady, Community Alliance on Prisons.
Thank you so much for hanging in there, committee. I know this has been a long day. We're really in support of this. 14 years we've been waiting to improve the program. This is really about sick people. And you've heard testimony before that not people use the cannabis in all different ways. And when you juice it, you need a whole lot. So I don't know how much, but you need a lot more. So I think it's really, really important that we put patients first. This is compassionate legislation. It's why we passed it in 2000. First legislature to pass a medical cannabis program. So please pass this bill and think about all the people you'd be helping. Thank you.
Thank you, Ms. Brady. Tracy Ryan, Libertarian Party in support. Mike Ruggles, Alternative Pain Management Puhuono in support. Malama Min, Hawaiian Standard in support. Robert Bacher, Green Futures in support. Hawaii Cannabis Care comments. We have a whole slew of individuals in support. Terry Heedy, Brent Neal, Brittany Neal, Marilyn Mick, Georgina McKinley, Dr. Kimberly Turnbull, Robin Temple, Aaron Kay, Javier Mendez Alvarez, Joseph A. Bobich, Mark, Hector Hoyos, Reed Kaneshiro, Victoria Lassner, Wendy Gibson, Wayne Miller, Dr. Myron Burney. We have testifiers in opposition, Honora Ing, Rogelio Herrera. We have late testimony in opposition, Officer Fa'a'u from Maui Police Department. In support, Pamela Lichty, Drug Policy Action Group.
Thank you very much, and now it's good afternoon. We're in strong support of this bill, and I'll be very brief. But as it says in the findings section of the bill, the point of this one is that it provides immediate measures that would assist patients. Even in the best case scenario, there's not going to be a dispensary system in place until 2016, 17, or later. So this would help people right now who need improved access. There's also almost been a gray area about how registered patients are able to begin to grow their supply. There's no legal access to seeds or seedlings, also known as clones. So permitting patients and caregivers to transfer these plants or plant materials would help address this issue that's been in place for a long time. As others have mentioned, a lot of patients for health reasons prefer not to smoke. They use edibles, they juice it, as has been mentioned earlier, and they vaporize. And many of these forms take a lot more of the cannabis than just smoking. And so I know it sounds frightening to think of the square inches of that might be available, but really it isn't what it looks like. People are trying to do things in a safer manner. And there's some interesting research that Rep. Creagan is probably familiar with, that juicing cannabis has had some quite startling results on shrinking cancer tumors. So, and finally, it's already been mentioned, the caregiver ratio issue. But if you think of the scenario where there's a husband and wife and a daughter, and they all have a blue card and they're living together, they would require 3 caregivers under the current law, which I think is absurd. And of all the states that have a caregiver provision, I believe there are very few that are 1-on-1 as restrictive as we are. Thank you so much.
Thank you, Ms. Lichty. Ellen Shin, Coalition for a Drug-Free Hawaii, in opposition.
Stand on my written testimony, Madam Chair.
In support, James Anthony, Hui Kahu Malama Puhi Pono. In support. Members, I have to look in our folder for the individual late testimony, so if you could just bear with me for 1455. So these are individuals who testified online. In support, Angela Breen. In support, Arvid Youngquist, Barbara Barry, Brenda Cloutier, Courtney Bruch, Dr. Myron Burney, Jean Dollar, Joan Hartfield. In opposition, individuals Fern Mossman, Carrie Benez, Leigh Learmont, Louis Powell, Dr. Louis Powell, Marty Tom, P.M. Azinga.
Aloha again. I'm standing in opposition of this bill. At the end of the day, the goals are really quite simple. Safety and security. And I believe this bill does not go far enough it lacks security equal to the level of prevention and forms of data that can also be compromised. My concerns are that written certification may be lost, duplicated, or forged. A preferred method perhaps might be fingerprinting verification of the registry, not only for the caregiver, but also for the patient. Also followed up by FBI, Interpol tracking, and plant sampling DNA registry so that you know where the plant specifically came from, and also the ability to prevent any kind of synthetic marijuana being made, which has led to deaths, and which is quite potent. Also, I'm concerned about the 4 ounces. The 4 ounces of what? The THC level. In the 60s, the THC was only like 3 and 4. Now the THC levels are like into the 15s. 4 ounces of that? What 4 ounces are you trying to give them? At what level? And for what cause, medical cause? Also, someone mentioned the vaporizing. Yes, we have talked about the e-cigarettes being an apparatus that even our middle school children, which it has quadrupled, middle school children are now using those e-cigarettes and the vapors to be able to put the marijuana in and all that kind of stuff. And that in Hawaii has tripled. tripled among middle students, but quadrupled among middle students, but tripled among high school students. And in this mix, when a caregiver is involved in allowing to transfer more buds or whatever, somewhere along the line there is going to be children that are going to be in the mix. Unless you're securing and locking these things up, the children are going to break access and have access, and I'm concerned about that transfer. Mahalo.
Thank you. We have testimony and support from Larry Caldwell. Testimony in opposition from Marty Tom. Testimony and support from Michelle Tippins.
Thank you for hearing from me yet again. I do want to stand on my testimony I've submitted, but I also want to address some issues in specific regarding the children. I hear a lot about the children. I have 4 of my own. I love kids. Parents have to be held responsible at some point. Our government is not designed to be a paternalized organization. We should not be infantilizing our society and treating them like they're not capable of making their own decisions and raising their own children and teaching their children their moral codes just as they should in other arenas. I teach my children not to steal, and that includes not stealing from me, which extends to my medication. That being said, in regard to 1455 and the plant numbers as I've spoken about before, because it's so qualitative, pain and conditions and muscular spasms and epilepsy and all these things, every person has a different specific set of needs. So quantity is very difficult to quantify because, like I said, I already use more than what my possession limit is, so I have to renew my quantity regularly just to have enough for me. And I'm in school, I'm upper level, I use my brain, but I need to be able to think through pain too. That being said, I've already mentioned that it's understood by the Hawaiian culture that some people are better at certain things and other people are, have other arenas. Each of us have our own kuleana, yeah? So we should be allowed to let people exercise their kuleana and grow medication safely for more than just one patient. And the exchange is important. On average, I have people approach me once a week asking me to grow, if I can be their caregiver because I'm, the magazine, so people know I have a blue card and I can grow. But the fact is I'm only allowed to grow for one person. And there's so many people that need the medicine and so few people that are growing for others that it really becomes a needed situation to allow, I don't bake bread at a bakery for one person, and I guess that's about it. As far as keeping it out of the hands of people who shouldn't have it, when you create a registered and regulated environment, you reduce accidental exposure. Nobody sells alcohol or tobacco to a child because they know the law restricts that. And people will not exchange medical marijuana when they're licensed to do it and operate outside of that licensed system if you don't force them to. People want to act within the framework of the law.
Thank you, Ms. Tippins. Testimony in support, Reverend Claudia Charters. Testimony in opposition, Rogelio Herrera. Testimony in support, Stanley Koga. We have testimony from Don Langford. Who's here?
Testimony?
Okay, after Mr. Langford.
Oh, okay.
If there's any other testifiers, if you could, is it this gentleman? Go ahead, Mr. Langford.
Okay, one of the concerns that we're addressing is, patients' ability to be able to get their medicine through trade, to be able to work with other medical card holders to make sure that they have an adequate supply, to make sure that they have good genetics in their plants, and if something happens where their plants die or they run out of medicine, they can work with another patient to help them get by. This is something that we can do now, something that we don't have to worry about setting up a dispensary for, something that we don't have to worry about taxation of. It could just be something that would allow patients to trade with one another. We need to get something in writing to allow meetings to take place for patients to be able to help one another. Meetings 1 to 4 times per month held at a specific location, I think are absolutely necessary. patients could come in, I'm hoping, and legally be able to transport their goods for trade. Somebody may not have the ability to grow, a few giant plants in their yard, but they might have the ability to produce a few small plants. Somebody might have the ability to produce one plant to grow seeds and trade those seeds for a finished product. These are the types of things that we can accomplish now, and they don't need nearly as much argument or paperwork as far as I'm concerned. I'd love to see something like this take place immediately. Thank you.
Thank you. Mr. Calvin Hulihe.
Thank you for listening for my my fish story, whatever. But I've been smoking marijuana from 1960. Let me see, 66. And marijuana at that time was real like kaloikai, not medical. But now getting old, everything. And before that, before after marijuana, they say, oh, as a drug, they're going to lead you to all kinds, which was true. For marijuana, you get what? I came to an heroin addict for 30 years. Then I went quit because I got tired go jail. So, I'm a caregiver too. I do my long way. I go in a million every 6 months. Caregiver. And I like it over there because there are plenty of dispensaries. But I worry about the health and safety about who growing them, who producing them, and what they put inside any kind. Because I used to grow before too, 1975 in Waiwa. And I had about 3 guys that come here, hey, do them this way, do them that way. So one guy come lunchtime, one guy come breakfast time, one guy come dinner time. And he listen, I'm stupid, so I listen to all these guys how they like tell, put this kind of fertilizer, put this kind of stuff. And then my mom, she not let me do them, but she telling me, hey, you gotta put this kind of stuff. She like how you grow the vegetable, she like organic. But anyway, I now I home, I need my marijuana. I don't can come when I come back from Hawaii, I got hard time because I don't can afford the license. And more dispensary. So you gotta go illegal. All my life I've been illegal anyway. But anyway, this stuff is illegal anyway. Me, I represent Kamehameha. That's my legal representatives that I represented. That I'm like one trustee or whatever you want to call it. Kamehameha, Kamuali, and Queen Iliokalani. That's the authority. Now I'm talking to you guys on authority. And I get 18% that kind of blood. So if I'm staying over 18 seconds or 18 minutes, I'm sorry. Let me leave, I leave. But if I can stay, I'll talk some more.
Can you just wrap it up?
Okay, I want to say about the dispensary when we need them. But the bottom line, the state should run them and regulate them, so they can make money, fix up all the infrastructure. Not government, whatever. State. It's not the state, but supposed to be the Hawaiians. But you guys running them too for the Hawaiians. Hawaiians was here. And we very get aloha. We're very compromising. I hope you guys compromising with this issue. But the first thing is safety and health. How you grow them, where you put them, in your neighborhood, and who the doctor gonna give it to, and who needs it. So I support them in a way where make Hawaiian kind of style. You do the assessment right and take your time. But the bottom line, safety and health, that's the main thing.
Thank you, Mr.
For
Goulet.
everybody's survival. Oh, 18 minutes. Okay, that's my Hawaiian. Kamuali.
Thank you, Mr. Goulet.
18%.
Thank you.
Aloha.
Thank you. Aloha to you. Members, any questions? Go ahead, Representative Jordan.
Department of Health, if you don't mind. I understand your testimony of a 1-to-3 ratio, but no comment on the rest of it. So if we were to allow that, maybe a 1-to-3 ratio, would you be able to change or have an adaptation to your process that is applicable between now and then sunsetting it by 17 when we in place the dispensaries?
My name is Lauren Kim, the Policy Officer for Department of Health. I would like to defer that very operational question to Mr. Whitaker.
Yeah, thank you. The registry program is currently in my portfolio. I believe we'd be able to do that. We'd be able to have 3 patients per caregiver. We have a database now that we would have to adapt, but I think we could do it pretty quickly. And I think it would increase access for patients, as you're hearing from other testifiers. But the provision would sunset when dispensaries available in each county. So if there would need to be availability of medication through a dispensary.
So basically what I'm hearing is if we were to pass, change the ratio, 1 to 3, you can have that up and running by July.
Or shortly thereafter.
Yeah.
Mm-hmm.
So that's my concern. It's not going to take you till January 6, 2016, and then we're going to sunset it by 2017.
It's relatively doable, and if it looks like it's going to go that way, we would start working on it before the due date.
Okay, and it's really not going to cause you to ask for any other additional positions, because I don't think there's going to be much more, right?
No.
Thank you very much, Chair.
Yeah.
Thank you.
Mr. Whitaker, I just have a follow-up question on the enforcement. Right now, I think we learned that with the 13,000 licensees out there has been no consistent monitoring or enforcement of the existing law. And so how would you be able to monitor the existing quantity of transfers between different caregivers and growers?
We're not suggesting here increased sharing between caregivers and growers, but just the ratio of patients to caregivers. That's the part that I was testifying on, that specific part of it, not the rest of the bill.
Okay, so but the concern I guess we have right now is by increasing would it help your enforcement maybe? Would it help your enforcement?
Well, it would neither make it more difficult nor easier, most likely, if it was 1 to 3. It would still appear in our database. We would set it up so if somebody tried to designate somebody a caregiver that already had 3 patients, it would deny it going forward. It would be on the card who the caregiver is. The growth site would be there, so the same basic information would be available. The other thing that would make it much more doable is with our new administrative rules, the plants are tagged, so you can actually identify which is the patient. There's 7 plants, and they belong to this patient. If there's another 7 plants, they need to be tagged with the registration number of another patient. And if there's any deviation from that, then they're not in compliance with the law. So between the tagging and the registration system, it'd probably be doable.
Thank you, Chair.
Thank you. Any other questions?
Yeah, I had a question, Mr. Whitaker. So if you could stand up the 1 to 3 ratio. You could just as easily stand up a 1 to 5 ratio.
It just becomes more complex. It may be doable. It's just the more people that you get in that system, the more possibilities, because you can be a patient yourself and then a caregiver for other people. It just becomes more difficult. It's probably doable. 3 seemed like a limit that was manageable. Yeah, and because it's an interim measure as well.
So do you think there should be overlap with the sunset date with the setup of dispensaries? Because one of my big concerns with dispensaries is that the cost of marijuana is going to increase. Sorry, I wasn't talking to the microphone. That the cost might increase with dispensaries, so that if people can set up a system with a ratio of caregivers that's larger than 1 to 1,
mm-hmm.
it certainly would decrease the cost and increase the availability to the point where when you set up dispensaries, the cost might jump up quite a bit, because given the cost we were requiring of people to set up dispensaries. So would it seem logical then to at least have an overlap of a year or 2 with a sunset date with the dispensaries until that's sorted out?
I think that's a reasonable consideration, yeah. Okay. The price of marijuana in a dispensary system, it really is unknown at this point. In what we look at the other states, they haven't had enough supply, so the price has gone up. So then they've issued enough license, so it increases the supply. So I think it's an ongoing matching of supply and demand. If the price is too high, the system isn't working because it's not accessible.
right? And if the price is too high, then the illegal system,
correct,
is going to
flourishes. Right.
So the more out there, the lower the price, and the less there is opportunity for the legal people to sell it, the illegal people. Right.
Mm-hmm.
Thank you.
I have one question. Members, any other questions? Did I hear correctly then that the DOH system is now set up that you know where the grow sites are for the caregivers?
We do.
Okay. But that's private information.
It is, correct.
I have to say that on this issue of the patient-caregiver ratio, my thinking has changed, particularly as we're looking at this hybrid, this transition time where we may be moving to a dispensary system. And what I'm very concerned about is the kind of linkages that might occur so that at a particular grow site, depending upon if you have two caregivers who might then be themselves patients. So you're looking at a place where there might be 28 plants. Now, one of the things that I'm concerned about, right, is that as we move forward, I don't, in a situation where we have the patient caregivers still being allowed to grow, which I support, that, I don't want to be in living next to a home where the next door neighbor is basically a grow operation for some collection of folks. So is there any language that we might be able to utilize to ensure that at a particular TMK that, we really want to kind of contain this so that there's not essentially a grow operation.
Right. And I've heard that from law enforcement that it does get to be much more complex when there's a lot of patients and caregivers together, and particularly if they're not tagged. There is no provision currently in the law. I could imagine one that would somehow limit the total number that could be within, as you're saying, one TMK or one kind of address. And I'm thinking the database could probably handle that kind of control. Yeah.
Okay. Thank you. Thank you. Members, any other questions? All right, seeing none, moving on. Thank you very much. Moving on to House Bill 794.